wonder why some pain medications work wonders for one person, but barely make a difference for someone else? Or why certain people experience side effects from even the smallest dose? In today's episode of Precision Conversations, we're breaking down how your genetics influence the way your body processes opioids and NSAIDs in the world of pain management. From codeine to ibuprofen, we'll uncover what really determines whether a medication helps, harms, or simply doesn't work. If you're tired of trial and error pain treatment, this episode is for you. I'm Dr. Neda Leonard, a dual board certified clinical pharmacy specialist and pharmacologist. And today we're diving into one of the most important topics in modern medicine, pain and precision. So what is the problem with one-size-fits-all pain treatment? Pain is one of the most common reasons people seek medical care. Yet the way we treat it is often still based on trial and error. Opioids, NSAIDs like ibuprofen and naproxen, and even medications like tramadol or codeine can work very differently depending on your genetics. Specifically, the genes that affect how your liver enzymes process medications. One of the most important gene families involved is called cytochrome P450, and more specifically, in this family, there are some members such as the CYP2D6, CYP2C9, or CYP3A that are of great concern. These enzymes act like traffic controllers for medications. If they work too fast or too slow, the medication may not reach its intended effect, or it can accumulate and cause a side effect. Let's focus on the critical intersection between these enzymes and the pain control. Let's start with opioids. Many commonly used opioids, such as codeine, tramadol, hydrocodone, and oxycodone, rely on liver enzymes, more specifically on the CYP2D6, to convert them into their active forms. And here's why this matters. If you're a poor metabolizer for this enzyme, these medications may barely work, no matter how high the dose is. And if you're an ultra-rapid metabolizer, your body may convert these medications too quickly, leading to dangerously high level of active drug and higher risk of side effect or toxicity. This is why some patients say, I took tramadol and it did nothing, while others feel sedated, nauseous, or overly sensitive to it. Genetic testing can help us choose safer, more effective opioid options and avoid the medications your body cannot process appropriately. Let's now switch to NSAIDs, as these widely available medications are not as simple as you think. NSAIDs may seem straightforward, but they also vary in effectiveness and safety, depending on your genetics. Medications like ibuprofen, meloxicam, celecoxib, naproxen, all of these are primarily affected by an enzyme in the cytochrome P450 family called CYP2C9, CYP2C9. And if you're a reduced metabolizer of this enzyme, NSAIDs may stay in your system longer. This increases your risk of stomach issues, kidney strain, and side effects, even at standard doses that we are most likely very comfortable taking. If you metabolize it too fast, then you may not get an adequate pain relief from this class of medication. Understanding your CYP2C9 status helps us choose the right NSAIDs and the safest dose. In our toolbox as pharmacologists, looking at the genetic results, we are able to pick the most appropriate member of this family as per your genetics. And then that helps in a way to mitigate the stomach issues, kidney concerns, and or even the effectiveness for the long-term treatment with this class of medication. For those who need the long-term treatment for arthritis, for chronic pain, and other chronic illnesses. So why does precision testing matters? Pain is not just a physical issue, it affects sleep, mood, function, and daily quality of life. So getting the right medication the first time matters. Pharmacogenomic testing gives us a personalized map of how your body processes pain medications. With this information, we can do a lot of different things. We can avoid ineffective medications, minimizing side effects. We can reduce unnecessary dose changes. We can improve your response to pain treatment. We can prevent dangerous combination with other medication you're taking. And as I always emphasize to my patients, it's not about more medications, it's about the right medication. At Precision Medication Center of Colorado, we use your genetic insight, your medical history, and your personal goals to tailor a pain treatment plan that fits you. Whether you're dealing with chronic pain, recovering from surgery, or exploring alternatives to opioids, precision medicine can help you find safer, more effective options. If you'd like to learn more or schedule a free initial consult with our pharmacotherapy specialist, you can visit our website at precisionmedicationcenter.com and choose to book an appointment, an initial free consult with one of our experts online. Thank you for joining me on Pain and Precision podcast today. I'm Dr. Netta Leonard, and remember, your pain story is personal. Your treatment should be too.